Hello, I'm Dr. John Scott. On behalf of my partners, Dr. Ed Rapp and Dr. Patricia Eichhorn, I want to welcome you to Greenville Health System's Bariatric Solutions, the Upstate's premier comprehensive bariatric surgery program. We appreciate your interest in our excellent program, and we'll take a few minutes to give you an overview of our program, team, and services. Afterwards, you'll have a chance to ask further questions, so feel free to jot down anything you may think of during this time. We are a team of bariatric specialists put together to deliver safe, effective, and comprehensive bariatric surgical care. Our team is composed of surgeons, physician assistants, nutritionists, psychologists, specialists, and nurses whose only professional goal is to make sure you get the best care, the best education, and the best surgery along your weight loss journey. In a minute, there will be a short presentation that will go into further detail about our services and the surgical options that we offer at GHS Bariatric Solutions. But first, we would like to take an opportunity to introduce ourselves. I completed my general surgery residency at the Greenville Health System in 2006. After completing a fellowship in laparoscopic and bariatric surgery at the University of Cincinnati, I helped start a program at the University of Tennessee in Knoxville. In 2008, I was pleased to join Greenville Health System's Bariatric Solution, where I've been helping the Upstate get to a better state of health. I currently serve as the Metabolic and Bariatric Surgery Director for the health system, and I'm deeply involved with the national advocacy movement for patients who suffer from obesity.
Hi, I'm Dr. Ed Rapp, and I'm a board-certified surgeon. I completed my medical degree in Georgetown University School of Medicine and completed my residency in the Phoenix Integrated Surgical Residency in Phoenix, Arizona. I then served the United States Air Force for 5 years with service during Desert Storm. Since that time, I have been in Greenwood, South Carolina, where we have developed a bariatric surgical program both in Greenwood and Aiken, South Carolina. I've had now the opportunity to join Greenville Health System to participate in their bariatric surgical program.
Hi, I'm Tricia Eichhorn. I finished my general surgery residency at the University of Medicine and Dentistry of New Jersey. I became board certified with the American Board of Surgery while completing a fellowship in minimally invasive bariatric and robotic surgery from Albany Medical Center in Albany, New York. We are grateful for this opportunity to help each and every one of you meet your weight loss goals. We believe that it's not about the weight you lose, it's about the life you gain.
Our program has been offering bariatric surgery care in the Upstate since 2001 and has been designated as a fully accredited center under the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program of the American College of Surgeons. We are very proud of the fact that our program is one of these top centers that have been designated in the state of South Carolina.
We are members of an extensive team of specialists that will provide you with the comprehensive care needed to make your bariatric surgery safe, effective, and give you the desired results. Our team members, some of whom you will meet today, will offer you the most complete training needed to prepare you for surgery and make the necessary lifestyle changes that will lead you to long-term and life-changing success.
Bariatric surgery allows people to lose weight and keep that weight off for good. But more importantly, it helps eliminate and reverse medical conditions associated with obesity. Be patient. You have taken the first step of many to reach your weight loss goals, and we commend you and want you to know that our team will be with you every step of the way for the rest of your life. During this time today, you will continue to learn more about the enrollment process, our personalized psychological counseling, the comprehensive nutritional evaluation, the lifelong commitment of our staff to you, and detailed surgical options. We want you to know how much we appreciate your interest and are here to help you with any questions.
It's important to know that the majority of all the services you'll ever need are conveniently located close to you. Again, it's our goal to make your surgical experience as comfortable and as easy as possible. We look forward to seeing you very soon. In the meantime, if you have any questions, please feel free to let us know. Now, please enjoy the following slide presentation that details the various surgical options that are available to you. And remember, it's not about the weight that you lose, it's about the life that you gain. Hello, I'm Dr. John Scott. Today we'll be viewing some slides regarding our surgical weight loss program here at GHS Bariatric Solutions. Did you know that over 100 million people in the United States are overweight or obese? In South Carolina alone, over 29% of its citizens, about 1.2 million people, suffer from this disease. There are many reasons for this increase in obesity in America. There are certain genetic factors that can predispose one to obesity. There are also behavioral factors that contribute to the problems as well. Our society has grown used to large portion sizes during meals. Many of our foods are high in carbohydrates and fats. Often, physical activity is the last thing on our minds after a busy day. Often, we find ourselves in a situation where we have an energy imbalance. We eat a lot of foods that are high in calories, that are always available, tasty, and attractive, and we don't have to expend much energy to get that food. We have cars, garage door openers, remote controls, all used to decrease the amount of activity we have to exert. So we have an imbalanced equation. Increased caloric intake and decreased energy expenditure leads to the problem of obesity. Before we can talk about how to solve the problem of obesity, we have to define some terms. Just what exactly is obesity? In scientific terms, we define obesity using a calculation called the body mass index. This is a calculation used to determine the level of one's obesity. It's a long mathematical formula, and we don't expect you to memorize it, but basically it helps us determine if a patient is at an unhealthy weight. Other calculations are used in medical practice, like the waist circumference measurement, but in our practice, the BMI helps guide our patients in their care. This is a BMI table. Across the top of the table are listed heights, and along the sides of the table are listed weights. To figure out what your BMI is, match up your height and your weight. For example, a patient that weighs 400 pounds and is 5 feet 4 inches tall has a BMI of 51.6. These tables are listed both on our website and within your surgical packet. There are different degrees of obesity based on your BMI. A normal individual has a BMI between 18 and 25. An overweight individual is defined as someone who has a BMI between 25 and 30. An obese individual has a BMI over 30. A severely obese individual has a BMI between 35 and 40, and a morbidly obese individual has a BMI that exceeds 40. Morbid obesity is defined as anyone who has a BMI over 40 or has a BMI over 35 and already has some medical problems related to their weight. This is a list of common comorbidities of obesity. These are medical conditions that are related to your weight. You may be familiar with some of these. Hypertension, which is high blood pressure, dyslipidemia, which is high cholesterol, sleep apnea, type 2 diabetes. Did you know that overweight or obese individuals have a 30 times higher risk of developing type 2 diabetes, reflux disease, joint pain, depression, immobility, and even cancer? Breast, bowel, prostate, and uterine cancer rates are directly related to weight. So who is a candidate for bariatric intervention? Well, in 1981, the National Institutes of Health developed a series of rules to determine who would benefit the most from bariatric surgery. What they determined was that individuals that had a BMI over 40 or a BMI over 35 with at least 2 medical comorbidities were excellent candidates for bariatric surgery. Also, those individuals had to be suffering from severe obesity for at least 3 to 5 years. Patients also had to fail medical management prior to undergoing bariatric surgery. There are different types of bariatric surgeries offered at Bariatric Solutions. There are surgeries that primarily restrict the amount of food that you can eat. These two surgeries include the laparoscopic sleeve gastrectomy and the Realize adjustable gastric band. There's another surgery known as the Roux-en-Y divided gastric bypass. This operation not only restricts the amount of food you can eat, but also rearranges your intestines so that you cannot absorb calories as efficiently. The first restrictive operation that we offer is the laparoscopic vertical sleeve gastrectomy. This operation was originally performed as a 2-stage procedure. But after having great success without doing the second stage, this surgery has now been offered as a standalone surgical procedure. It is now the #1 performed bariatric operation in the country. Last year, 52% of all bariatric operations were gastric sleeve procedures. We have seen a similar trend at GHS as the sleeve has gained popularity. Basically, what we do is insert a small tube into the stomach, and then we divide the stomach along this tube using special surgical staplers. This gives the stomach the shape of a sleeve. About 70% of the stomach is divided and then removed and then discarded. This operation is restrictive only. We do not rearrange the intestines, and this allows a patient to eat a small amount of food and feel full. Also, the portion of the stomach that is removed produces a hormone called ghrelin, and this is thought to be responsible for a portion of the appetite. After the sleeve procedure, many patients say that their appetite decreases significantly. The laparoscopic gastrectomy has also shown that about 75% of patients will have a reversal in some of the more common related comorbidity diseases such as high blood pressure, high cholesterol, and even diabetes. We like to say that the gastric sleeve is a good compromise surgery because the risks and results sit right between those of the gastric bypass and the gastric band. For example, the gastric sleeve will have a lower complication rate than the gastric bypass, but a slightly higher complication rate than the gastric band procedure. In terms of weight loss and results, the sleeve performs much better than the gastric band, but not as good as the gastric bypass. The average surgery time for the gastric sleeve operation is about 1 to 2 hours. We perform the operation through 5 small keyhole incisions. There's an overnight observation with the discharge in the morning after surgery. Patients will go on a standard postoperative diet after the surgery and also return to work in about 1 to 2 weeks. The Roux-en-Y divided gastric bypass surgery is one of the most common bariatric procedures performed in the world. It has been performed in hundreds of thousands of patients since the 1970s. Since this operation is the oldest of the 3, we have the most accurate long-term data on the results of the operation. It is the operation which most bariatric surgeons have the most experience performing. The Roux-en-Y gastric bypass has 2 components. The first component is that it's restrictive. We create a small stomach out of the old stomach. This new pouch is about the size of a golf ball. It holds about 3 to 4 ounces of food. The second component of the operation is malabsorption. That is, the intestines are rearranged to drain food out of that new stomach. We bypass about 6 feet of intestine that will no longer be able to absorb food. As you can see with this cartoon, this surgery is also performed laparoscopically through small keyhole incisions. The instruments are introduced into the abdominal cavity and the abdomen once again inflated like a balloon. The first part of the process involves dividing the stomach with special surgical staplers. Once the stomach is divided, this creates a new stomach or the gastric pouch. Once again, the pouch is about the size of a golf ball. The intestine is then divided, and a new part of the intestine is brought up to the new stomach. Food goes through the swallowing tube, which is seen here in blue, and the gastric juices from the old stomach are shown here in green. Food is not absorbed until the gastric juices mix with the food. So in effect, 6 feet of the intestine is bypassed. The typical course for the laparoscopic gastric bypass is approximately 2 to 3 hours. We make 6 small keyhole incisions. There's a 2-day hospital stay, and a small drain remains in 1 week after the surgery. Patients will have ice chips and exercise the day after surgery and then be placed on a postoperative diet the 2nd day after surgery. Many patients can return to work approximately 2 to 4 weeks after a gastric bypass. Remember, our procedures are often performed laparoscopically through small keyhole-like incisions. Approximately 99% of the time, patients will undergo a successful laparoscopic operation. However, from time to time, patients will need to be converted from a laparoscopic operation to an old-fashioned open operation. The reasons for opening include bleeding, or if there's too much scar tissue from previous operations, or if the patient has unusual anatomy. Since 2001, a small percentage of our patients have had to receive an open operation. A very common question we hear in our practice is, "Doc, which operation is best for me?" When you come to the office, we would like to talk about the risks and benefits for each procedure and then let our patients make informed decisions based on these. Each patient should make that decision based on their needs. This decision will be made in combination with the individual consultation with the surgeon. We encourage all of our patients to research, and this includes talking to other patients who have had the various procedures, listening in on support groups, and researching different information on the internet or in the library. Any abdominal operation has potential complications, including bariatric surgery. Some of these complications include leaking at the staple lines or bowel connections. There's always a potential for abdominal infection or abscess formation. Blood clots can form in the legs, which can sometimes break off and go to the lungs. Sometimes patients can develop bowel obstructions, internal herniations, even future wound complications, which include infections, hernias, or scars. Some patients suffer from nausea and vomiting. Some patients even have problems with anemia or malnutrition due to the rearranging of the intestines. All patients are required to be on special vitamins for the rest of their life. Patients can also develop ulcers, especially if they smoke after surgery. Weight regain is always a potential complication from any bariatric operation. However, if patients are able to follow the instructions that we give them and make the necessary lifestyle changes after surgery, weight regain should not be a problem. Once again, as with every surgery, there's always a risk of death after an operation. Thankfully, with the advances in technique and perioperative care, this risk is very minimal. In fact, bariatric operations are much safer than other commonly performed abdominal operations, like gallbladder surgery or cancer surgery. Although there is a risk with each one of these procedures, we believe the rewards and benefits from decreasing weight highly outweigh the risks of surgery. For example, almost 80% of patients will have an improvement in their diabetes after losing weight with an adjustable gastric band. With gastric bypass surgery, the results are extremely favorable. 85% of patients after a gastric bypass, their diabetes will go into complete remission. This usually occurs within the first month after surgery. With high blood pressure, about 70% of patients will stop taking their antihypertensive medications. 80% of patients can come off their CPAP machine, and approximately 95% of their patients can stop taking their cholesterol medications. A recent study in the New England Journal of Medicine demonstrated that bariatric surgery, either bypass or sleeves, have a greater chance of bringing a type 2 diabetic patient into remission from their disease than diet and medicine alone. In fact, 40% of patients who had a gastric bypass, 24% of patients who had a gastric sleeve went into complete remission from their diabetes, even after 3 years after surgery, as opposed to only 5% of patients with medicine and behavior changes alone. Here's a study that our group published in 2011. What we found out is that when patients have bariatric surgery, they have a 25 to 50% lower chance of having a heart attack, stroke, or dying as compared with other morbidly surgical obese patients here in the state of South Carolina. Here is another study that our group published in 2013. We demonstrated that if you are a type 2 diabetic and you have bariatric surgery, you will have a 50% lower risk of having operative complications of diabetes, like having eye surgery, going on dialysis, getting amputations, or having heart attacks or strokes. This study also showed a significant lower risk in dying if you chose to have bariatric surgery. So there are many benefits for weight loss surgery. Weight loss surgery cures or puts into remission many comorbid diseases like diabetes, high blood pressure, sleep apnea, and it also helps prevent the development of debilitating diseases such as arthritis, diabetes, and sleep apnea. The surgeries give patients more energy, more stamina, and helps improve their well-being and self-esteem. And more importantly, bariatric surgery helps extend your lifespan. For example, some of our patients come with many preoperative medications, and a month after surgery, all they are taking are bariatric vitamins. In our experience with Bariatric Solutions, we have performed over 4,000 bariatric operations. We have an overall 2 to 3% complication rate. And yes, we have had some leaks. In fact, we've had 20 leaks after surgery, but only 2 of our patients have required reoperations due to leaks. 4 of our patients have suffered pulmonary embolisms, and unfortunately, over the past 14 years, 4 of our patients have died within 30 days of their operation. We do everything we can to minimize the chances of having complications around the time of surgery. We have an extensive network of cardiologists, anesthesiologists, dietitians, nurses, and psychologists to ensure that you have the safest experience during your hospitalization and recovery. We are also members of the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, which is a national effort sponsored by the American College of Surgeons. The program is designed to enhance the safety of these bariatric procedures and to provide our patients with the most current, evidence-based surgical care that is available. Overall, our results at Bariatric Solutions are very favorable. Gastric band patients typically lose between 55 and 60% of their extra body weight over a period of 2 years. Gastric sleeve patients usually lose approximately 70% of their excess body weight after 2 years. Gastric bypass patients lose their weight faster. They lose approximately 30% of their body weight in 3 months, 60% of their extra body weight in the first 6 months, and most patients will plateau at approximately 80% weight loss of their extra body weight. At Bariatric Solutions, we value long-term follow-up. Our physicians, our physician assistants, and our surgeons feel that this is absolutely essential. We see our patients 1 week after surgery, then 1 month, 3 months, and every 6 months until we're comfortable letting our patients go from year to year. During these visits, we'll monitor your surgical progress, follow laboratory studies, and adjust your medications when you don't require them anymore. We also encourage our patients to attend weekly post-operative support groups. We have ongoing nutritional and psychological counseling that will be available for the rest of the patient's life, as long as they remain engaged in our program. These services are provided for free by GHS once the patient joins the program. In essence, our approach to surgical weight loss includes the following: We want to give the patient enough nutritional resources to be successful after surgery, educate the patient on what life is going to be like after surgery, have intense behavioral modification to adjust to the new surgical anatomy. We'll do this through support groups. We'll have great communication between the psychologists, dietitians, medical doctors, and surgeons, and then we'll give you a great surgery to give you a safe, effective, long-lasting result. I'm a firm believer that every slideshow should end with a quote. And remember, today is the first day of the rest of your life. If you're ready to make a change with your life and you desire bariatric surgery, we strongly encourage you to join our program today so that you can enjoy the results of a successful weight loss surgery. Thank you very much for your time, and we hope to see you at Bariatric Solutions.